Evans, and the article I selected for my Healthcare Leadership Symposium is entitled Improving Healthcare Communication for Caregivers, a Pilot Study by Paul D. Smith, Beth Martin, Betty Chewing, Stephanie Haves, Aaron Leake, Jewel Ryken, and Rachel Smedley Ramos. This article was published in the Journal of Gerontology and Geriatrics Education in September of 2016. I specifically chose this article because as the healthcare climate changes and the general population continues to age, we've begun to see and will continue to see more and more informal caregivers assisting family and friends with their healthcare needs. I currently work in the healthcare field, specifically in the private duty home care sector, and depending on the state and state regulations, we often utilize non-licensed caregivers to assist our clients. I was very intrigued to read this article and better understand if specific training and communication to informal caregivers could help improve overall client outcomes. If so, I was hoping to use this information that it would be easily applicable and transferable to unlicensed caregivers that I utilize in my professional life. The study began by defining informal caregivers as persons who provide unpaid support to family and friends, labeling them as a shadow workforce. They indicate that these informal caregivers provide a variety of services, including but not limited to geriatric case management, medical record keeping, paramedic activities, and being a patient advocate. With so many responsibilities, we often see what's referred to as caregiver burden or caregiver burnout. Caregiver burnout can have a variety of outcomes, including anxiety, depression, and sleep disturbances. In 2009, there were approximately 61.6 million caregivers in the United States, and one would expect that number has grown as our population has grown in recent years. The authors indicate that a significant issue for caregivers is their ability to understand, use, and find healthcare information, as only 12% of American adults are proficient in health literacy. Because this lack of health literacy, many people find it difficult to make healthcare decisions, develop and complete a plan of action. Improving effective communication between healthcare professionals, patients, and caregivers is one proposed method of addressing these issues, including reducing caregiver burden. In order to improve healthcare communications for caregivers, this pilot was designed to increase caregiver self-confidence to communicate effectively with healthcare professionals. The study was conducted in Monroe, Wisconsin, and the data collected between April and October of 2014. The trainers modeled the communication behavior, learners rehearsed the desired behaviors, and then learners received constructive, positive feedback on their communication style to enhance their skills and self-confidence to achieve their desired outcomes. Additionally, this program consisted of four 2-hour workshops, and the authors conducted 3 series of workshops with approximately 2 months between each series. The workshops were a combination of didactic and skill-building exercises, including brainstorming, problem-solving, and role-playing. Workshops included the following 9 topics: identifying facilitator and barriers to effective communication, caregiver negotiation, their role with caregiver recipient, developing a list of concerns and questions before a healthcare visit, or essentially creating an agenda, sharing concerns in a positive manner, sharing concerns and asking questions during a health visit, a primary care physician's view of an ideal visit, reviewing key points with their care recipient after a healthcare visit, acting on disagreement with a healthcare provider, confirming understanding using reflective listening, which is defined as when a listener repeats key points to the speaker to confirm correct understanding of what was said. Participants were a convenience sample living in Monroe, Washington, that met the following criteria. They were informal caregivers or not paid. They provided daily living skill assistance to their family member or friend and or accompanied them to healthcare visits. They were fluent in English. They demonstrated cognitive ability to provide informed consent, and they cared for someone over the age of 60. Exclusion criteria included the inability to attend all workshop sessions, lack of telephone access for follow-up surveys, and the care recipient was the caregiver's child. In order to establish effectiveness, the program, a researcher administered a baseline survey by interview at enrollment and a follow-up survey by telephone. Additionally, the program evaluations included 4-question surveys after each workshop. There was significant improvement in a 10-item composite of communication competence, with pre- and post-interview scores of 74.1 increasing to 79.6. There was also statistically significant improvement on mean scores for questions about use of reflective listening, from 6.9 increasing to 8, and developing a list of concerns to discuss with the physician, from 7.8 to 8.5, and additionally, at least 80% of the participants reported using 6 of the 9 workshop skills. On the program evaluations, all 15 program mean scores were between 3.7 and 4 on a 0 to 4-point scale. Overall, the comments of the review of the workshop were overwhelmingly positive, and the authors indicated that they felt like they accomplished their primary goal, developing a well-accepted program with high attendance rates, many positive participation comments, and 100% follow-up, as all 15 full participants who answered the questions affirmed that they would recommend the program to a friend. Participants included 16 people who attended at least one class. 100% of participants completed the post-interview survey, but not every participant answered every question. 75% attended all 4 workshops, and 25% attended 3 workshops. 100% of the participants were female, with a mean age of 71, and 93.8% identified as non-Hispanic white. Additionally, 8 participants had worked in the healthcare field during their lifetime, and 4 of those were nurses. While this pilot study seemed to have positive results from the participants, and I certainly think that any type of education and communication would be helpful for caregivers, I feel the study had several limitations, including a very small sample size of only 15 to 16 participants, with at least half of them already having some kind of healthcare background. I believe that this in itself skews the data, as healthcare workers have a much higher health literacy rate and already know the basics of how to interact with healthcare providers. Additionally, I do not think the pilot results can be extrapolated out to have any real meaning in relation to general population, as the participants were 93.8% white and all females. With no real diversity in the participants, the results can't really be a good representation of the general public. While I do think there's some question regarding the successfulness or usefulness of this pilot, it does present some interesting topics for discussion. Some of these discussion questions would be, do you think that informal caregivers can affect or improve the quality of outcomes for those that they care for? What do you think is the biggest factor related to caregiver burnout? Do you think improved communication between caregivers and healthcare professionals can have an impact on caregiver burnout, and if so, why? Of the 9 workshop topics, which topic do you think is most important and why? And lastly, do you think investing in informal caregiver communication education is a good utilization of resources and healthcare dollars? To conclude, I specifically selected this article to see if I could superimpose any positive results to my current professional work. And while I think that this pilot has several issues, I do think that it made some excellent observations on health literacy and caregiver burnout, which improved communication can always be helpful to both of these. Thank you so much for taking the time to listen to my Healthcare Leadership Symposium.